Hello and good morning, everybody. Welcome to the Pearl Cruz Show, Making Nursing Visible. On my show today, I have a very dear person to me whom I had worked and who was probably the first person who exposed me to the nuances of how to be a chief nursing officer. I have on screen with me Dr. Jothi Clara Michael, of course, a PhD, currently who is a group director at Gleneagles Healthcare India, which is part of an IHH group. She has been an assistant dean at Sultan Qaboos University, a clinical governance officer at Kaveri Hospitals, has been an ANAI founding member and a member of ANBAI, CAHO, HPI, INS India. Wow, there are so many groups. I think the list will go on and on. And of course, an NABH assessor. So, welcome to our show, ma'am, and thank you for gracing us with your presence here.
Thank you, Pearl. It's my honor and a privilege to be with you on this show. I would really congratulate you for the great step that you have taken forward to bring nursing to visibility.
Thank you so much, ma'am. I think that's the least we can do as nurses to talk about ourselves and tell them the contribution that we make to the society. It's very, very important. It's time that people like me in the next generation take up, the torch and move ahead.
When I went for the first innings to Kaveri, and then when I came back, there was a connect between you and me, because when I was about to leave, that's a time like you were chosen, and then you came and took over the CNO position. I gave a recommendation saying that out of all the CNOs, you would be the best person to take my hats and take the nursing lead across India. So that is what was my recommendation given about you.
All right.
And I'm very glad that you have grown beyond that.
Thank you so much, ma'am. Thank you so much. Thank you for all the trust that everybody has been having in me. I hope I live up to everybody's expectations. Moving on to our question, ma'am. I saw a very strong talk given by you at the Indian Chamber of Commerce. You highlighted a very, very important topic about outcome-driven emotional resilience program for nurses, something which probably we have heard of very less. Can you share a little bit about it? And do you think our healthcare leaders are paying attention to this aspect?
Yes, Pearl. Emotional intelligence and emotional resilience is very less focused, not only in nursing, I think across in healthcare. And I don't see policies revolving around it and learning and development happening around this. So this is a very crucial part, and we all experience it by trial and error method when COVID struck us, and even otherwise in day-to-day dynamic environment. Because nursing in healthcare, especially in hospitals, it is very critical for us to have this resilience. And if we fail to prepare our nursing folks right from the student period, they would not be able to sustain nursing. And my worry is like we should not lose nurses from nursing. And we need to retain talents in nursing, and to retain talents in nursing, this is very important aspect. And these are not like we are not born with these resilience is one critical aspect that we need to carefully carve into the competencies of the nurses right from the student period. If we fail to do so, we will be having nursing folks losing out from our community, and the talents will be lost. So it will be a great loss to not only to the institution but to the country as well. So it is very significant that we divert our attention to formulating specific policies around it, especially on building emotional intelligence, emotional resilience, and also put it into an L&D practice where we train and develop them. If we don't do so, what will happen is at the ground level, in reality, the dynamic demand that the clinical situation places on nursing leaders will either allow them to become more submissive, or probably they will keep churning and moving from one hospital to another, because they will not have the growth to be an accomplished leader, or probably to climb up the Maslow's hierarchy to actualization position. So I think this is a very critical part. In this, I just wanted to mention one significant program that can be given for nursing leaders are anti-resilience. It's a new term that I learned maybe 4 years ago. This anti-resilience, I also tried myself because I love to work in gym. So
Mm.
it's very close to that. Like when we go to gym, what do? We keep our muscles getting worked out and we build them. But if you don't do that for a month or so, what happens is the muscles get little weaker, the muscle mass reduces. So what I believe is the concept of anti-resilience is it's a day-to-day practice. So if we don't practice regularly being resilient emotionally, and we give away for some time, like okay, for this person we would not be who we are in our resilient, we will accommodate. So twice thrice then we become a different personality as such. So what I like to emphasize here is that anti-resilient concept is every time we have to demonstrate the resilience, especially emotionally in front of our leaders, in the boardroom, when we are in a committee, when we are working with clinicians, because this is not being aggressive, that we have to be very clear. This also could be considered synonymous to empowerment, being resilient, assertiveness, and also we can say that like the person is speaking up. So
Right.
when we are able to demonstrate these competency, then we would say that we are building resilience.
So, ma'am, like I asked, are our healthcare leaders accommodated to this concept? Are our healthcare leaders doing anything to, accept our nurses and build the resilience?
Yes, it is happening. See, I have thoroughly enjoyed in my earlier days, both in the academia and in my hospital industry. The resilience is the one that had pushed me to what I am today. And in young nurses, it is not difficult for them to adapt this concept of anti resilience, but they need a nurturing environment. I'll just give a small example. We had put in a policy that patients have to be shifted based on criteria from ICU.
Right.
But what happens is some of the consultants say, please shift. Then the
Hmm.
nurses go with the protocol and say, these are the ticks I have done. The patient mu score is not allowing me to shift the patient. Can we retain the patient in the ICU for some time? And
Mhm.
then we would shift. But the doctors would not accept, right? And when it comes to the attention of management, they also sometimes support nurses, sometimes support consultants.
Mm.
So here, what happens is there is a deviation in policy happening.
Right.
Now, how do we build in resiliences when such situation occurs? It happened to me once for my
Mm.
nurses. So when a senior orthopedic surgeon, he came to my office and he said, Clara, I want to talk to you. I said, okay, please sit down. Then he
Mm.
said, you know what? I'm 50 years old. When I tell this Chota nurse to shift the patient, she's showing a paper, very bureaucratic, and telling me, no, sir, I cannot shift the patient because the criteria is not fitting. Then I told him, doctor, I
That's
said, why don't you sit down? Why do you think she's doing this? Who's going to be on the press when success happens? And do you know what is a concern? If the patient goes out of her care, patient will go into the ward. In the ward, patient will not have that one-to-one attention. Probably patient will come back to ICU. This will again extend the length of stay, extend the cost of patient. So, okay, fine for financial status. If you want to push the patient from ICU to ward, still we can talk to management. We can tell management that this patient can be stepped down while still in ICU for few hours. So this much of consideration certainly organizations would do. So we'll help you out of this. So this nurse who was strong enough to tell the doctor very softly, subtly, firmly, would become a resilient nurse if she had the right nurturing environment. Or you call her and tell, why are you resisting? Just do whatever doctor says. Then we will not be able to. So it's a very simple example, but I think you could relate it with so many other examples around.
absolutely,
Best
absolutely.
thing what you have to do is if you want to build in resilience among nurses, just tell them a blanket rule. I told this to the doctor. See,
Mhm.
if I roll out a policy, even I cannot change it with my nurses, because nursing is such a faithful community. You teach them do this, they will do it
Absolutely.
very consciously, and continuously they will be doing it. So when I told this, he said, I really appreciate the way you negotiated me rather than telling your nurse not to do that. Anyhow, it is convincing me.
True. I think it's very important to find a midway because sometimes the doctors come back saying that the nursing directors are very stringent. They don't like some of the nursing directors who are very strong and put forth their point. But I think somewhere finding a midway and then doing what is right is very important. I like the example of resilience that you gave, and I think thanks to accreditation standards like NABH or JCI that the hospitals are implementing.
Exactly.
It's allowing nurses to do that. The whole cultural shift that's happening from just following what a doctor says to doing what is clinically right. I think that is what, and that's the reason why I always appreciate the accreditation standards, because it gives you a platform to do what is right, and it makes the nurses also so comfortable to stick to the policy.
I also would like to give you another personal experience of mine. Like, we have to start the knife time at 8 o'clock in the morning in the
Mm,
theater. But always the nurses will never be enough.
mm.
But we start the theater by 11 o'clock. My man hour of nursing is getting wasted.
Wasted, yeah.
So, in order to do that, like I used to take in the earlier time, because I moved from academia, it was a very challenging situation for me to take up a new role in the hospital. And I used to go for rounds at the time of 7 o'clock or 7:30
Mhm.
when the first patient is wheeled into the theater. And I used to sit in the front desk of the theater. Yeah, and I used to see, and one of the doctor surgeon came to me and told, when I was driving my car, your face came to my conscience, and I was thinking, oh, you will be there 8 o'clock knife time. I have to be here. Then I immediately called called the theater, and I told them, just keep everything ready. I'm there. So when you start the knife time at 8 o'clock, you're able to close it as early as 5 o'clock or so. The nursing manpower, the other resources are effectively getting utilized, and it also promotes safety for patients rather
Absolutely.
than starting theater very late and then closing the theater very late. And almost the active hours of people in the hospital is gone.
That's absolutely right, ma'am. The resource utilization hours. I mean, every calculation of manpower of nursing is planned on the resource hours, and if your 3 hours of resource hours are gone, it just puts every it puts in jeopardy. So yes, but I like the fact that you were sitting there. So somebody, that's what sometimes our nurses need. I feel somebody in leadership position is there, standing there, not just sitting on the chair and telling me, but there with me. Because that's what strengthens them and says that okay, and it's like a clear example of role model. Today you're sitting there, tomorrow probably the theater manager will sit there. Yeah, thank you for sharing that very great example. um, when I was working at Global Hospital, that was the first time I saw that there were different verticals of specialization. I remember some of them like tissue viability nurse, which is back here in UK is very critical role here. Then I saw the infusion nurse, the medication management nurse, and so many other verticals that you had created. The quality nurse, the educator, which we commonly see in every hospital. But there other things also, like the tissue viability nurse, and there was a nice guidance written for them, what they're supposed to do, what's their roles and responsibilities, the audits that they need to conduct, the presentations that they need to know, the rounds that they do need to take every day. And they were hugely contributing in reducing so many errors in the hospital, and a lot of preventive measures which help to reduce the length of the stay. So you've always had this larger than life vision for nursing. That's what we're going to title this show with you today. Would you like to share your vision of nursing with us? What would you like to see in nursing in future?
Yeah. Thank you, Pearl. I'm very happy that this particular concept has been embarked into your memory lane, because when I moved out from academia to healthcare, I took a week to contemplate, to design how my nursing directorate should be. And that is the time when I met Dr. Ravindranath. I did do a presentation on this. So the vertical that is created is called as quality and education vertical. And this vertical will be reporting to CNO as a parallel vertical to clinical stream. So it is a domain out of practice, but which will facilitate. So this vertical will facilitate the practice safety and also quality of the practice of nursing. And they are not only focused on nursing, but they will also be supporting other stakeholders in the hospital, other departments in the hospital. For example, patient safety nurse works with the facility manager, works with the radiation safety officer, lab safety officer. So she has a bigger role. That's why we named it as nurse managers.
Mhm.
So only at the manager level they can take up these roles. And to my surprise, it has turned out to become a very good strategy in our hospital. I can say it is a USP and a DNA for us. And these nurses have got prescriptive role. Yeah. In the sense like a nurse or a doctor who needs to know that how can you protect the skin or a pressure injury prevention, they can always pick up the call and she can suggest. So she has a prescriptive role. A burns patient coming to ER, she'll be called to the attention. Same way HIC nurses, same way the patient safety. So they have a prescriptive role very clearly defined, and they work very closely with clinicians.
Mm.
Like they go on rounds with probably a plastic surgeon or a surgeon who's involved in various stoma care or probably the major dressing. So she goes with them. So each of the category, including like diabetic nurse counselor. In fact, diabetic nurse counselor was able to have revenue stream also.
Wow.
So her counseling, doctors write counseling, then she used to go and counsel and it will be charged. And patients were very happy. It's just a small amount. And if the patient is getting readmitted, reinforcement training, just a
Mhm.
cost of 100 rupees. Okay,
Yeah.
it's in the package. So nurses were very proud. They said, and I can still remember one of the patient diabetic nurse counselor came and told, ma'am, it is 4 lakhs is the what I'm able to give to the organization by my counseling. So it was really wonderful. Stroke nurse practitioner, same way. They were they worked with registrars. It
Mm.
was very convenient for nurses to connect with these people and take opinions. And I'll tell you why did I attempt these new initiatives. I attempted basically because I strongly believe like we should not limit, we should liberate. I always see nurses beyond what they are in front of me. And every interviews, I also tell them that I see you beyond what you are today. And that has pulled them forward to become very proud nurses as an initiative nurses. And they are called now as clinicians. The title equivalent is nurse clinicians. So we name them because in IHH they have these roles. So we
Mm.
put them in equal as a job matching as nurse clinicians. So tissue viability nurse, patient safety nurse, medication management, patient safety, stroke nurse, practitioners, all they are called as nurse clinicians who are very strongly presenting them in front of the clinicians. Of course, it's very difficult to digest for a new entrant into our organization, but soon when they see their outcome and
Right.
the benefit that they are getting by their involvement, they become very happy and they become inclusive in involving them in committees and other activities. Only when you set the standards high, we can use the push and the pull factor to elevate nurses and give them the recognition through their performance.
And that is so very important, ma'am. I think that is what the vision of a nursing director should be: to set the platform right, to give them the guidelines, to be there when they need you to be there around them. And I think, like you said, they are beyond what they are. They can do so much more, only if we give them the opportunity to do so. Because, like
And
you
believe,
rightly, yes,
and
believe
believe.
them.
We have
Yeah,
to
because
believe that they can do.
absolutely, because they come as professionals, don't they? Just like a doctor or any other professional would come. They come as professionals. They have so much body of knowledge with them. But it's disheartening to them sometimes when they see that what all I have learned in the books, I'm not able to practice that. I'm just doing the basic nursing care. But when we give them these kind of platforms to sort of, explore themselves and prove themselves, I think they build more confidence. And I'm seeing more and more such endeavors happening across the country, where there are nursing directors who have this kind of vision. And I think these are the hospitals which are sort of standing out nowadays. I wouldn't want to name. I think when I say that, everybody knows which all hospitals are actually standing out when it comes to nursing empowerment. But I have always had the joy and fortune of being a part of such organizations. I think I should be really
And when it comes to vision, Pearl, I would like to tell you there is something that we have evolved into after you have left, which is
thankful.
called as CONE, Center of Nursing Excellence.
I saw the board,
Because,
ma'am.
yeah,
Yeah. It's
I was,
beautiful.
no,
It's beautiful.
I used to see we are building programs in medical fraternity, and these programs are not successful without nurses. So when you have a liver transplant program as a program of center of excellence, I can claim that we have a center of excellence in nursing in liver transplantation. So what did we do is, like, each of the hospitals will have 2 to 3 centers of nursing excellence where they are the prime departments, and the nurses are special there because they contribute a lot, not only to patient care, clinical outcome, but to the revenue of the hospital, the success rate. And I would always give this as an example. Donor program would have become a failure
Mhm.
if one of our nurse has not been vigilant. He is currently pursuing, or I think he's almost completed medicine and he's practicing in US. That's what the news I got recently. He was my nurse when a donor patient went into arrest. He gave adrenaline. Just a moment, few minutes, the doctors are there around, but he did it. I know what gut feeling he had and what is the confidence we all gave him that made him to do that. And I think that was a great moment. Today, I remember him when we say we have crossed 2,500 transplant programs. He is one person I have to acknowledge today to say that he has contributed. I also vision that nurse practitioner in par with clinicians should come up,
Yes.
and they have to practice. And not only in the critical care area, but also in OPDs, in clinics, they have to be partnering with the clinicians, and they have to cater, especially country like us with larger population where
Yes.
they say ratios are very less. I wanted to emphasize and tell today about invert the triangle. This is a very powerful phrase. I want audience to listen to this. Invert the triangle. In a hospital, you count how many clinical HODs are there. You have so many clinical HODs, at least 175, maybe 50 in very small hospitals. But how many nursing HODs are there? Only nursing director.
Yes.
In addition to medical director, you have these HODs. So I wanted to invert the triangle because our triangle is very straight. All are in the bottom. We are on top, lone leaders. But I want to invert the triangle saying that we grow stronger on top. And all the members or the nursing managers who are heading departments should be in par with clinical HODs. Then the triangle is inverted. I have HOD who's managing the critical care facility. I have a person managing the endoscopy department, theater, very strong and in par with me. They are paid and the remuneration is good. Then we will have such people coming in to take positions. So this is my dream. And there are more dreams which we'll probably share as we go.
Right, right. But that's a very very insightful thought, ma'am, of inverting the triangle. In fact, we do have, Nasa, like you said, a theater manager is well respected by the doctors. But I think what you're trying to probably say is to give them that onus and recognize them. That's how I think probably also, like you said, the right career pathway. Then somebody like a junior nurse will look up to saying that I want to be there tomorrow. Currently, as of now, they think that I want to be a deputy chief of nursing or a chief of nursing, or probably, now because of the infection control nurse or a quality nurse. These are the only things that they look at. But when they look at all these, HODs which we want to portray, there will be so many career ladders that will be created, and that's something I think is very important in
So
today's
they will not
nursing.
move into administration, but they were
Yeah.
clinicians very
Yes,
strongly
very strong
staying there.
clinicians. That and they have the knowledge, they have the skill sets, like HIC, the infection control nurse. When you said about prescriptive role, she's been having this, yes, for long. The I've seen so many critical care doctors asking, oh, this patient is CMV positive. Call the IC nurse, infection control nurse, and ICN, and ask her what do we exactly want to do. I'm sure soon enough, we will see this nursing clinician, HODs, like you say, up there with everybody's efforts together. Right. Moving on to our next question, ma'am. Let's go back to your dean days at Sultan Qaboos University. You were an assistant dean. You developed a lot of academic programs there. What do you see as a difference between that place and our system of education, do you think we need any sort of a change in the way we teach nursing here?
So there are merits in both ends. Like we are no less to the system that they have. But there are few things that we could adopt, which is very important for us because as I give you a few points, you will appreciate that it is important for us to take few learnings from my experience at Sultan Qaboos University. The first experience was like just when I cleared PhD, I decided I would not sit for interviews. People will call me and I'll be taken for job. It is a very challenging situation that I put to myself. And to be honest, till now I've never sat for interview in front of anybody.
Amazing.
After that, it
Yeah.
was all meeting and discussion and then the job, right? So I got a call from Sultan Qaboos University and they said, you are invited for 3 days and they send the visa, everything. Then I went, they have given a good accommodation and then. So from day one, you will not believe a 3-page plan for me. Like who will I meet
Mhm.
every hour and with lunch with somebody, dinner with somebody. And there was a session where I meet the faculty and students and give away a talk. And there are HODs, both from nursing and non-nursing, from academia and from hospital. And when all these finished, I was thinking I'm very religiously taken through my plan. The third day, when I went, I was called to Dean's office, and there, Dr. Bastavi. I I still remember and salute him for his magnanimity and the powerful leadership. He's a medical person. He's a dean of the medical college university. So I went to his boardroom and I was waiting in the waiting area and he stepped out, opening the door with a box of chocolate and dates.
Mhm.
Then he said, Jothi, welcome, Dr. Jothi. This is a special dates that is given to me. I wanted you to taste it. Why don't you take this? Then he took me inside. My God, when I went inside, I saw close to 15 to 20 people in a round table.
Wow.
And all those who I met in the last 3 days.
Mhm.
And I was made to sit in one side. He sat on the other side. And then he said, so, Jyoti, how do you feel? And I said, I'm very surprised and I'm very happy too, because I'm seeing all of the leaders whom I have met the last 3 days. Then he said, all of them have given a report to me. Do you want a good news? Then I said, of course. Then he said, when are you coming to join us? That's
Oh.
it. I was so happy because each of them gave an individual report about the encounter that I had with them. And there were few questions also on the ground. So this was a very different thing. So I always respect people when they come and I always give time when I meet nurses for the first time. Whether it is a nurse,
Yeah.
just a fresh nurse or a nurse who's coming for a job. This is very important and we have to learn that actually, this particular
Right.
concept. The second one was clinical instruction.
Mm.
We have to adapt certain things from them because the clinical instruction is well planned. Current system for us is we don't know how many students are there in the theater. This is all planned. We accept few students from this college, that college. But there the system is so good. And especially when I was leading clinical affairs, I used to lead the students planning for the whole, I was in the committee. So there are students, colleges are there, the hospital is there, Sultan Qaboos University Hospital is there. So there are few other hospitals. So we have maybe 3,000 students. Where do these 3,000 students go? When do they go? What is it? It's a mapping that is done.
Mm.
So everybody gets an opportunity. The students are equally getting opportunity. It's not luck enough to learn. You
Mm.
understand what I
Yes,
say?
I get that. Yes,
So
yes.
it is all planned for, there are maybe 10 colleges, there are 25 hospitals. So the students knew that they will go to this hospital, that hospital, the other hospital A, B, C, and what is the duration. So everybody gets equal opportunity for clinical exposure in all specialization. That is something fantastic, a collaborative framework that they have. I admired and I was part of that leading also. It was wonderful. Second thing is ratios. Their
Mm.
ratios are very particular. And one thing that I learned, which shifted my mind, was the students' empowerment. The students are empowered to demand support and help in the clinical instruction. and in the theory. 10 minutes, students will wait in the classroom. If
Mm-hmm.
teacher doesn't turn up, they have the right to leave the classroom
Oh, amazing.
to do their self-study. Now, sometimes it looks rude.
Mm.
I think when we value time, this is very significant. And the mind shift that had happened, which I told you, know what I learned, like you have to explain to students why did he or she lost 2 grade or 3 grade or 2 points. What
Mm.
is that? They won't focus even if they get 98% in their rating. They'll only focus on what is the 2%, why I did not get this 2%. Doctora, can you explain to me?
Mm.
Right? And we will have clinical instructors also who are working with us, who will go to the clinical area, be with them as a identifying preceptors and putting them on training. The students will come back and say that I was left unattended in the clinicals for 15 minutes. Imagine if our students in India had to tell this. So a faculty cannot leave a student unattended for 15 minutes.
Mm.
This is a kind of aspects that I have taken as a positive learning for me. And I think, I know it, country like India, we say it may not be possible, but it is possible. It is just the mind shift that we have to have. One more thing, the last point that I would like to tell here is we have a very powerful faculty development program. I was just zero at online course designing. So they brought in something called as Moodle platform that time. So I volunteered. You will not believe within 6 months, I was able to develop 7 Moodle online courses and also tried out the final year research course being delivered online
Mm.
with 7 other PhD guides involved with 47 students. So I can say that the faculty development should yield outcome.
Yes.
We also have learning and development, and but outcome driven initiatives are well appreciated, and
Yes.
I really enjoyed that. And test construction is another challenge, like you will not have anybody to develop your mm, ppts or your test papers or anything. So everything we have to do it, and we have to send it for evaluation, very confidential. We have to go, we enter the barcode system, everything is there. So we have to enter it. Then we will get a report as a faculty
Mm-hmm.
saying that how powerful is your test construction at the end of the exam along with your feedback. So
Mm-hmm.
thank you, your test construction has these 4 points. Like there are 3 questions which are very confusing to students, so you have to be careful next time in preparing questions.
Oh, that's a good thing. Yeah.
You know how it is facilitating us and developing us.
Absolutely.
It's
Yeah.
driven into the process, and that actually helped me improve my ability in test construction and evaluation of the test process. So these are few things.
These are amazing things, ma'am. I'm not sure, and this was probably what, about 10, 15 years back, 10 or 15 years back.
Between I went by in 2005 and I stayed till 2009
Yeah.
before I could join Global.
Yeah. So I just hope all these things, because I've been a professor in a nursing college, but a good one, a premium one. But I think these are few things we can learn and take, because it's very important for a teacher to know. I like the part about test construction and an evaluation and a feedback to the teacher saying that how strong your test is, or are the questions ambiguous. We learn all this when we do our masters in methods of teaching. We learn all these concepts, and we try to imbibe with our intelligence, saying that okay, this is not confusing. We do a inter-rater test or a validation test between two teachers and say, okay, is this fine? But I think a very scientific approach to this is really going to help in building your question papers, asking the right set of questions to the students. I like the aspect about the empowerment, student empowerment, so important. I don't know if
And
this.
and at the end of every course, you will be getting a report,
Mhm.
and your report will be very exhaustive, and they'll place you where are you among the university scoring and where
Mhm.
are you among the college scoring. So if university score is 4.5 out of 5 and my college score is 4 out of 5, I should certainly be beyond that average score.
Yeah.
So it helped me because I was always above the average score.
I'm
and
sure.
that gave me a lot of empowerment and enthusiasm to progress forward. And I was one of the preferred teacher, I could say, and I truly enjoyed working with the students there.
I'm very sure, ma'am, you were, because our next question is something on that. So you were the first PhD chief of nursing in a standalone corporate in 2009. I'm sure you all your experience from Sultan Qaboos University, amazing skill sets that you gain, and the way you proved to everybody, I'm sure they would have. I mean, nobody would can guess that you would stand up to the position of a chief of nursing. You were mentored by the, for deanship. I think it was in USA, in University of Wisconsin, and you mentioned these two names, Dr. Rosemary Smith and Dr. Jaya Jambunathan, who mentored you. I'm sure they have a very strong influence in your life. That's the reason why you've spoken about them to me. And you were certified to take up the dean position, but you prefer to move back to India, get into chief nursing officer. What's the story behind all this?
Okay. I would really say that my mentors are very powerful mentors. I have strong mentors right from the beginning. Mrs. Vadana Prabhakaran, who mentored me to become a principal in a school of nursing when I was 4 year BSc nursing experience.
Mhm.
And I have another mentor who had mentored me in my master's program. She is not clinical person, and this is Valle Alahappan. I have seen her as a very powerful woman,
Mhm.
and I watch her from far, and she even doesn't know that she has mentored me many times. But once she mentioned in the alumni meet that I wish every nurse is cloned like Clara. When I heard that, I felt very humbled, and I respect Madam Valli Alagappan a lot. Of course, there are many mentors who groomed me in CMC, but in my experience time, like when I'm growing, when I was in the cream of my leadership, Dr. Jaya Jamuna then stepped in.
Mm.
So she was one person who had mentored me, and she is a very close friend of mine. So we are planning for international trips and all.
Oh,
And Rosemary Smith actually took me to the Senate office, Senate meeting, and she had gave me a true visibility of what a deanship is abroad. I did not plan for abroad job. I wanted to come back after Sultan Qaboos University to be in the education field in India.
mhm.
So she strongly recommended to one of the university where she wanted me to take up the dean position, but it was all God's plan. I went into clinical field. The reason for me to go into clinical field is I thought I would not be able to contribute the best with the existing system of education in healthcare.
Mm.
I don't know why I perceived it right that way. So it was like for me going from furnace to fire, but
It
it was
was.
a great learning. So the first day when I walked into the hospital, when our chairman introduced me to the group of doctors, she's Dr. Jothi Clara. She has finished a PhD. She's going to be the chief of nursing here. The first question, their eyebrows were raised, and some of them came to me. Why at all you want to take after doing all such good job to be head of nursing here? Then I said, soon you will see what is head of nursing, because you don't know what is head of nursing is all about. Then I started
Mm.
working, learning many things. And of course, I called Daisy, Daisy
Mm.
from Reliance, Godrej.
Oh, yes,
Daisy
yes. Daisy from Godrej. Yes, I know.
and Elizabeth. Dr. Karan Jaker was there that time with us.
Yes.
So I called them to evaluate the hospital.
Mhm.
I told, please measure me. Am I
Mm.
a right leader in nursing? And Elizabeth came and she did a complete assessment of the hospital, and she said, Jyoti, you're really doing amazing job, and the nursing team is in a very clear track. You will not believe, I joined in September, August, September 2009. September 2010, we are getting NABH certification in a
Amazing.
big gala thing. And that is the time we met Dr. Giridhar Gyani first time. He was then CEO. Then I
Mm.
asked him, so many things are happening for doctors because I am new to healthcare industry. We should do something for nursing. Then he said, as his style, no, chalo, do something. I am there to support. Then
Mm.
that is a time like I designed a program called Reshaping Nursing in India, invited 11 leaders, thanks to Quality Council of India. thanks to NABH. They sponsored. Yeah, Deepthi from NABH was there. Um, Dr. Gideon Gyadgyani was there, and we had a very good conference with the University of Wisconsin Oshkosh faculty and faculty from other universities and internally also. It was a wonderful international conference, a lot of brainstorming. The first
Mhm.
nursing core committee for nursing excellence joined together. And Dr. Miss Abanti Kopan is one person I very prominently remember because we used to share ideas about doing something like magnet status in India.
Right.
And then later we had developed the policy protocol around it. And if you go even into the book, you will have the list of nursing leaders, 11 of them. I don't know where I got the guts or what to say, the idea of making this. Finally, when it went and they called for the final meeting, and then they launched the nursing excellence certification program. So I just turn back and see like what is the reason for all of this is probably first is God's plan that I have to be in healthcare. And I was the youngest, I could say, because I came from academia in 2009.
Mm.
But my focus was always just nursing and nursing and nursing and
Mhm.
my nurses. That's
Yeah.
it. And
Yes.
anything that I can take as an opportunity to expand nursing, I'm there.
And we are witness to all of that growth. Thank God that you you came back, because it's not just one person, ma'am, right? There have, I mean, I always feel that the pieces of jigsaw puzzle have to fit together to make a complete picture. So people like you, I remember my mentors as well always told me, let's do what we are supposed to do. Leave everything else, always focus on nursing. And that's where it will start growing. And I have seen all the people who have probably come on the show also are the ones who have always focused on nursing. And thanks to them, that the young nurses have a better platform to practice on, they feel a little more empowered. Gone are the days where nurses were just, supposed to give injections and tablets. Nurses are doing higher roles, and so thanks for coming back and implementing what you've done. Such a marvelous job in nursing.
We cannot change the world, Pearl. We can only change things around us and
Around
change
us.
us.
Yeah, and the world will change, ma'am. And the world will change. I'm so happy to see a lot of changes that are happening with nurses in India. So there's this one big question which we ask everybody on our show. How do you think we can make nursing more visible, ma'am?
First and foremost, we have to prioritize nursing in policy documents and build a very strong employer brand. I mean by saying this, like we humanize our organization by communicating to people. Why do we need experienced nurses and why experienced nurses would like to come and work with us? Very important message that has to go around. You can also advertise like leading job for nurses in boards, which is another thing that can give a lot of visibility. Addressing burnouts and stopping nurses quitting job, very important. And that will actually bring and turn around a lot of visibility for nursing because we'll have so many testament to share. Where do we position nursing is one question always in my mind when it comes to visibility. Are we in the organization second or third top layer? When I mean we, the nursing leaders. So
Mm.
reporting structure, very important.
Yes. Yes.
Are nursing heads given the authority to be the decision makers in all aspect of their nursing domain? They should be the ultimate decision maker. Others can give inputs. So that right should be given to them. Of
Mm.
course, they have to be eligible for that, but at the same time, the rights also to be there for them. And they should have a budget for
Mm.
nursing. And not only that, they should have the empowerment to use them rightly. So that is another very important aspect. And at the national level, Pearl, what I feel is state and the national level, we must have nursing universities. Currently, we have DME, DMS, but
Yeah.
the nursing positions are always vacant.
Mm.
And even if the positions are given, they are not the right executive positions. The
Mm.
execution part and the decision making part is very meager. Probably this is another important point we have to look into. Probably few states have got, but
Mm-hmm.
mostly by and large it is not there. Nurse Practice Act is another thing that has to come on roll. all the nurses should be governed and protected by the Nurses Practice Act, especially in India. I'm talking about India.
Right.
We don't have roles such as nurse scientist at government and NGO bodies, and even in ICMR. Having had PhD doctorally qualified so many nurses, we don't have representation. I'm not sure whether now they have inducted any nurse into ICMR in the position, top position, but I have not heard about it. Apologies if there are any. Nurse leaders' representation on boards and national committees, very significant, because lobbying for nurses and nursing profession should be one of the criteria when we want to elevate our profession.
Right.
And the evolution of newer nursing titles like chief caring officer, nurse
Mm.
advocates,
Yes.
nurse engineers, nurse information technologist. These are very important. And I see few entrepreneurs emerging in nursing. We have Tankam, we have Ajita, we have few more members coming into entrepreneurial role. And soon I'll also be joining them probably because I always want to be a 360 degree. I was an academic. I started off with a community practice, then
Mm-hmm.
an academician, then clinical practice. I'm into research currently, involving in research and other activities. My next move would be entrepreneurial. So
Wow.
that would complete my 360 degree as a nurse
Mm-hmm.
specifically and doing something for the stakeholders who are depending on us. And nursing leaders have to spread their table to showcase themselves. If
Yes.
they don't spread it, nobody will spread our table for us. So
Absolutely.
that needs a lot of guts and boldness. And a small start is very important. So, how do we start showcasing in a small thing as like creating storyboards? Every single activity happening at the ground, at the bedside, has a story to be told, to be heard, to be listened. It is not done. And I also apologize because I was not able to do much on this area, but I have done my best. Like you see, our nurses' wall, I have
Yes.
shared you the nurses' wall.
Yes.
So it talks, it's a story. It talks about the nursing, the power
Mm.
of nursing, the power of nurses. It's just
Yeah.
not the leader, the connect they have. So we need to have stories being spoken. So the stories are very important, and storytelling should become a fashion, and that will actually bring in visibility. Storytelling by nurses, students, leaders, that will actually bring in thought process, provoke ideas, accumulate more strength and energy and resource. And we have to cross our boundaries.
Yeah.
We cannot be very close community. Now it's time for us to spread our wings and cross the boundary and fly high so that our visibility is seen like an eagle's eye who's soaring high above the sky. And that is where we have to place our nursing. Then we will be able to see nursing quietly.
Absolutely, ma'am. Amen to that. I wish we are contributors to that day when it comes. So thank you for sharing that. A lot of great insights in there. A lot of, I think, pathways also, in a way you said, how we can do these things and how we can make nursing more visible. Thanks for that beautiful insight. And hopefully we'll get to do that together someday. So,
Sure.
moving on to our next set of questions, ma'am, we go on to the rapid fire round. And whatever first thing that comes to your mind, we can just shoot it out. So, ready to go?
Yeah.
Right. So, if not a nurse, then what other profession would you see yourself in?
An academician where I could still make a significant impact on generation through value instilling and building healthy and next generation.
Awesome. Uh, and one advice you would give to your younger self?
Embrace every opportunity for learning and growth. Does not hesitate to step out of your comfort zone.
Right. That's absolutely correct. And one advice you would give to young nurses?
Never stop advocating for your patient and yourself. Your voice is the most powerful tool.
Yes, yes, very, very important advice. And what would be an advice to the nursing leaders?
Prioritize mentorship. Invest in the next generation of nurses,
Yes.
which is crucial for the future of our profession.
Yes, and I think more than necessary in for now. Yes, only then this profession is going to go high, like you said. And what would be one advice to the non-nursing leaders?
Okay, it's a very powerful message I want to give here. Understand the value of collaborative leadership. The best outcome happens when everyone's expertise is respected, utilized, and recognized overtly. I'll
Yes.
repeat, understand the value of collaborative leadership. The best outcomes happen when everyone's expertise is respected, utilized, and recognized overtly.
Yes, strong message. And I hope the non-nursing leaders listen to it. I think it's just going to do them good. So yes, right, ma'am. What are the three things that Indian nurses possess compared to the rest of the world?
I love Indian nurses. The three things that they possess. I'm telling this out of my own experience with the 38 years of experience I've worked with them. Resilience in challenging scenarios, a strong foundation in evidence based practice, although it is not documented and published. Yeah, I'm making it, although it is not documented and published. So there is a greater scope for evidence based practice in our
Mhm.
country. Deep rooted compassion for patient and families. Deep rooted compassion for patients and families.
Yes.
Yeah, we can see them communicating with patients and the family members when they
Mm.
come for hospitalization, and they get sometimes even emotionally attached, and they detach themselves at the time of discharge.
Yeah.
These are the three things that I have seen very strongly in Indian nurses.
That's so true, ma'am. Resilience, yes. I think everybody needs to appreciate the resilience that our nurses hold day by day, coming back to the job, going through all the grit and grind. So, absolutely. One motivational quote that inspires you to continue your journey with such enthusiasm.
Let me read the quote which I wrote when I placed my resignation on the same day evening. This is July 10th, 2024. This quote is a very powerful quote for me. I have engraved into my heart. True success and happiness comes from loving what you do and making a meaningful difference in the world. Remember that every difficulty presents an opportunity, and to find true satisfaction in life, you must pursue work that aligns with your passion and beliefs. Written by Jothi Clara.
So true, so meaningful, and so very right. Yeah.
So I have done away with quotes from others. So this quote is going to lead me for my next innings in my
Definitely.
life.
Absolutely. Quotes have such a huge impact on our life. I remember putting quotes on in my room as well, on the boards. I think my kids also follow that. It is so inspiring. And one to create of yourself. I think you'll be more truthful to the quotes that you derive out of your life. You're going to stick by it. I'm sure, ma'am, whatever you're planning to do, I'm sure it's going to be the next big thing. And I'm sure there'll be so many more nurses who will be inspired by the journey that you've shared with us over here. Like you said, you're covering the 360 degree. I'm very keen to see your next, inning that's going to come, which is going to complete that 360-degree circle. But the journey has been so
Amen.
inspiring. Amen.
Amen.
Yes, amen to that. Amen to that. But I'm sure,
Always God, always God plans what is right for us,
yes.
and it is always better to go by God's plan.
Yes, yes. But thank you so much, ma'am, for being a part of this show, for sharing all those insightful things that you've shared, which is going to definitely inspire more nurses, more younger generation. And I'm sure they will be there proud of their professions, looking at the likes of the nurse leaders like you, saying that, because sometimes it happens to introduce yourself also to anybody, where do you work? To say that, oh, I'm a nurse. Nurses sometimes think twice, but things are changing, and I'm sure people see this show, these kind of show, not just my show, but all the shows that the nurses are putting up for everybody to see. And tomorrow I don't want any nurse to stand there and not introduce herself proudly as a nurse. I'm sure that day is slowly coming. There are many nurses who are proudly saying I'm a nurse, and I'm sure in the future every nurse is going to stand and say that I'm a nurse, and people are going to look up to that position very soon. So thank you for gracing us with your presence, and for this for the wonderful uh, quote that you left us with.
Thank you, Pearl. May God bless you. Your intentions are very clear and your aspirations are fantabulous. Keep rocking, keep moving. I think whatever we could support as leaders from India, we are there for you.
Thank
We
you so
love
much.
you.
Thank you so much, ma'am. Thank you so much for all the blessings.